Hey, happy Thursday, everybody. It is chamber check-in time. I am so excited to get the year kicked off. And today we have Dr. Joshua Crank. He's the owner of Boise Dental Chair. And he's with us today. Hi, Dr. Crank.
How you doing, Paul? Thanks for having me today.
It's my pleasure. You know, we've been doing this series for a couple, 2.5 years now, and it's a way to engage with our members and help share their people, their products, their services. And I love hearing our members' origin stories too. So why don't we dive right in, Dr. Crank?
Sure.
Tell us a little bit about your history as a native Idahoan, you and your wife both, and you've been in Boise for a long time. Tell us a little bit about your story and history of work.
Absolutely. Yes, born and raised here in Idaho. I grew up in Emmett, so not very far from here. So I'm a local boy, no doubt. I knew starting this business, but before that, I knew I wanted to be a dentist at 8 years old, and people are kind of surprised by that. But growing up in Emmett, our family dentist pulled my tooth when I was very young, 8 years old, and I knew at that minute that's what I wanted to do.
Wow.
So that's where it got started, and things kind of went from there. But I joined the military right out of high school for an 8-year commitment, and then went to Arizona State University and got my degree down there. And then, and when I was there, Arizona surprisingly didn't have a dental school at the time. And so my wife and I, and she was pregnant at the time, and we moved to Charleston, South Carolina, a beautiful city, lots of history. So I've never lived by the ocean, and that was a great school to go to. I really enjoyed it. And then after that, came back here to Idaho, the motherland. This is where I belong. Very biased towards them. I love them. And so we came back here, and I did a residency at Idaho State University. And then I went into private practice after that. And in the same time, I was an instructor there as well. So.
Okay. Well, with a name like Dr. Crank, with the last name of Crank, it's humorous to me. When I was in high school and had braces, there was an orthodontist that really cranked down on me. And
oh yes.
I thought that was kind of funny. Tell me how your office treats the humor and kind of the atmosphere and culture in your offices.
Great question there. When people come in, they're very nervous, and people get, they're just high anxiety, high stress. People, and unfortunately, I really hate the stuffy dental office atmosphere in most places. And so, when people come in, we're very lively, Julie up front, very approachable, and people feel instantly calm with her. And we have a very homey environment. You can see a fireplace behind us there, and people calm down pretty good. But when they get in the back, we like to interact with them, and it's all business, but at the same time, we make it fun and enjoyable, and really we talk and get to know people. And going through that makes a big difference. And I tell people every time when they sit down, hey, be yourself. This is not something, you don't have to pretend to be somebody you're not, because I don't want to be in people when they sit down. They want to be themselves. And so that's what we really push here, and people really enjoy it. And so, we get a lot of people that come in, and they definitely make their follow-up appointments. But we have fun.
I love it. So you've been in the dental industry for how many years?
10 years. Yep, 10 years.
And then how long have you had this practice?
I've had this practice for about a year and a half now. That first part of the career was getting to this point. So, and I knew what I wanted. And unfortunately, a lot of the places, and I stole from them as far as what their ideas and what to do and what I really liked. And that's what I put into this office. And, I wanted a really calm atmosphere, and where people, again, can be themselves, and so they can relax. And, I wanted to be treated. I want to treat people how I wanted to be treated. And that's what we do here. So,
hey, where are you located?
We are located at 5360 North Eagle Road, Suite 101 on Eagle Road, where there's no traffic, and we're the only dentist on the road.
Okay. No traffic on Eagle Road. Where's that?
Yeah. Everybody's like, oh gosh, the Eagle Road. I don't want to drive down that. But, we're pretty central in there, and you can get, there's access on either side of the street. So it's pretty easy to get in and out.
I think one of the most important things about the dental offices is your team, your
Yes.
hygienists, your front desk folks that are greeting you. Help me share or help share some of the expertise from your team.
Well, first of all, we're a family practice, and so it's a team. It's a team. My sister Julie works up front. She has a lot of experience in dental offices and corporate. So she knows what she's doing up front, and she's very approachable, very nice, and is more than happy to help people. So she's a great icebreaker for people that come in high anxiety, like I was saying before. And then in the back, I have my wife who works in there, and she's a lab tech. She's been doing it for 20 plus years, 23 right in there. And so she makes all the crowns. We do everything custom, and so we really tailor it to the individual when they sit down and give them exactly what they want. And it really just cuts down on delay, pushing things down the road. Nobody's happy with that. And then I have my assistant, Monica, and she is a great. She's excellent. Like, I can't work without her. We've been working together for about 5 years now, and patients love her. She's easy to talk to. Just a great individual. And people go, when she's not here, I miss her. And then patients always ask, "Where's Monica?" And so.
Right.
So she's really great. And then we have another individual, Terry. He's a vendor that comes in, and he's pretty regular, and we see him, and he knows he's important here because he has his own coffee mug. We got him. So
that's awesome.
Yeah.
When you're talking about anxiety and,
sure.
and going to the dentist, and I've been doing these check-ins, and Delta Dental has been a sponsor for a couple of years. And one of the things I learned from that partnership is overall health begins with oral health. Tell me a little bit about that and help explain why dental health and oral health is so important.
It's very important. I'll throw this out. If you have a cut on the bottom of your foot, you go right to the emergency room, get it taken care of. You're not going to walk around and have a sore open on the bottom of your foot as you wear your shoe and live your life. But people have expected that, something in the mouth is acceptable, and that's not. If you had an injury or a sore in the mouth, that's the gateway to the body. When you're eating anything, it helps prevent disease. And then this time it's the most important. So, oral health is great. It's great in growing up and developing confidence with individuals. Their teeth look great, and they have the confidence to smile, and it shows it in their attitude as well. So, yep. And that's all the way through life. But again, it's the gateway to the body, and without great oral health, it really affects a lot of systemic issues, diabetes, heart disease, quite a few things in that regard.
In your office, what kind of services do you provide? Are you there for regular visits? Are you there for the crowns and root canals? Tell me are you a full service outfit? Help share that story.
You bet. We're a full service dental office. We provide, again, everything under the sun, as far as we do refer out for specialty work, as most general dentist office do. Our youngest patient is 1.5 years, and our oldest one is up in 97, 98 years old. So, wow. Yeah, we treat children, teenagers, and adults into their golden years.
Okay.
Very much.
And what do you recommend for people as the new year is underway? As far as visits to their dentist and getting caught back up on if they've lapsed a little bit on their dental care.
You bet. Great question. A lot of people will finish up the last year. They'll finish up, and if they have insurance, that really pushes people to get in and get things done. But as the new year starts, we do see an uptick in patients that come into the office where they will, well, I want to just start new this year and I want to get things under control. And that's great. Really, whatever reason gets people in to see the dentist, it doesn't matter as long as they get in. And then we get them in and we go through and we take a comprehensive look and then provide them with a treatment plan. And so they have everything up front, but mostly, we encourage people to get in, and I tell people dentistry is not expensive. Neglect is. And so, and I talk to people on where they're at and their age and their conditions. And, I encourage them and say, hey, it's never as bad as you think it is. And it's not. And, and a lot of people that do come in and we present their treatment plans, they're like, wow, I'm kind of surprised it's this little. I thought there was a lot more. I thought you were going to pull everything. No, that's the last thing I want to do. No.
I tell you what, there is not a feeling that's better than when you leave the dentist and you have whatever procedure done, or just the regular teeth cleaning. There's such a good feeling about it.
It is. Yep. Yeah. I agree with that 100%. You walk out and everything feels squeaky clean, and you can go to the restaurant and order what you want and not be concerned about, well, it's going to be a little hard to get down or anything like that. Yeah, you stay up on it. Maintenance is real easy. Absolutely, it is.
So patting yourself on the back, going to the dentist is definitely encouraged.
Very much you should. Very much.
Hey, I'm going to keep to some of my questions here. You've got a great video on your homepage of your website, and I'm going to put that website up here so people can see. So it's BoiseDentalChair.com, and on that video is a story of your patient first way of going to business. Help share your patient first story with me.
Yes, absolutely. Thank you for the comment. That's a generous comment on the video. Editing makes everybody look great. So, but in all seriousness, when it comes to the video, that's how I truly feel. I'm sure everybody that's listening to this now has had an experience that they really hated when they went into a medical office. And so with that, I try to address all the negative outcomes or experiences that I've had myself personally. When somebody comes in, we always want to make sure that they're well aware what they're getting into, and so there's no surprises. Nobody wants a big bill when they're just ready to walk out the door. When somebody comes in and they sit down in the chair, I always make sure to inform them what we're going to do. People have unfortunately, they have the white knuckle grip. I can see it in their eyes. They're pretty nervous about things. And so, I inform them on what's going to happen so they're not concerned about, oh, the next step's going to be painful or he's going to get me this time, and that's simply not the case. And then, when everything is over and they're leaving, I make sure that they have plenty of information. And most importantly, I give my patients a record, my cell phone number, so they can text me. And what happens there is, they're at home and if something doesn't feel right, or they just are a little nervous, they send me a text. It takes a couple of minutes and they calm down quite a bit. So, I could never do those things I felt like in different offices that I had experience with. And I just wanted to address that. And I think we did that in the video.
It's another thing to just be aware of is,
yes,
if you start your process of continuing your dental care and you go do your checkups and you do your routine cleanings and maybe you get a crown or a cap here, maybe a root canal, but the more, and I'm one of those anxiety guys. I don't like a needle in my arm. It's tough to go get my annual, especially a needle in the mouth. But what I've learned is in the last 5 years, I've been going to all my routine cleanings. I've gotten all my stuff updated. And now I've made it to the point where I'm not anxious anymore. I know what's going to happen. Yep. I have a good relationship with my dentist. And they're like, hey, we need to get this done. Okay, schedule it. Right. And I don't get that preconceived anxiety anymore. And I think it's just because of the repetition of getting back in the groove.
Very much true. And that's exactly, as people come in, they're very nervous when they sit down. Just in here, the smell of the office. I'll say it for young children. Let's point out that, I'll say, hey, you have young children, bring them in every time you come in, because they'll get more accustomed to this environment. They'll see me. I'm not a stranger to them. They'll know mom or dad is okay and things are going well for them. So I encourage that to start that habit very much early. Unfortunately, people have anxiety at young ages of children all the way up, to 98, 98 year olds. It's just,
Wow.
just how it goes. And everything that you said is exactly what a lot of people experience.
Well, I can get my kids to go to the dentist, Dr. Crank.
Yes.
I can't get them to eat beans.
No, more like candy. Yes. Yeah, it's hard. It's hard to get that. I'll just tell you a quick story real quick. My son, when he was growing up, this was when I was in dental school studying very hard, and I was drinking a soda, a Coke, and I had it in a glass, and I poured it in a glass, and he came up to me and said, "Hey, Dad, I wanted to drink," and I was like, "Oh gosh, this is it. This is when I lose them." And so what I did is I poured cold coffee in another cup and handed it to him, and he drank it, and it was so bitter he hated it. I kept him away from wanting soda for at least 3 years, I think, or so. So those things are very effective in that way, and so. But again, some kids want, have not the greatest eating habits more than others. And so, right. But, whatever works to keep, your children or even yourself, everything looking good, that's a great way to go. And again, maintenance is easy.
It really is. And if you keep on it again, you'll be less anxious. The more repetition you get at your routine cleanings, you're all good. And you always feel so good. Dr. Frank, I wanted to thank you so much for your investment with the chamber, and congratulations on your and your family's new office there in Eagle.
Oh, thank you, sir. Thank you. I really appreciate it. We love the chamber. As far as what you guys do, I really like the involvement. You guys are very interactive. And so, we're going to continue to stay with the chamber. And I do, as far as I definitely have my colleagues, and I encourage them to join as well.
That's awesome. Mm-hmm. Well, Dr. Crank, thanks again for carving out a little time to help share your origin story. This is the perfect time of the year for people to make their appointments with
it is perfect. Very much so, Paul. I agree with that. On Eagle Road, where I'm the only one,
Awesome. Hey, that was so much fun, Dr. Crank. Have a great weekend. And again, thank you again for your membership and your time today.
You bet, Paul. Thank you very much.